All the attention this week, of course, from a national political perspective, is on Joe Biden, the former president, and his medical team announcing on Sunday that he has aggressive stage 4 prostate cancer. So we had to go into the coffers and figure out who we can talk to, who might be an expert in this area. And it just so happens I know somebody very well who is. And that is my college roommate from our Villanova days. That is Dr. Patrick Leidig. He is a urologist now in Georgia. He went on to George Washington Medical School, did his residency at Duke. So you can tell which one of us was studying back in college and which one of us wasn't. All right, Patrick, good morning, my friend. Great to have you here. What was your reaction to President Biden when you heard this news from a medical perspective, and what your thoughts were on essentially what this guy has been going through and for how long?
Well, Pete, thank you for having me on. I really appreciate it, and thanks for the kind introduction. I think you and I would both agree that, like, there were some nights that I didn't do as much studying, but I'm glad I made it through okay. Yeah, I was pretty surprised. Last week when the news initially broke that he had this nodule associated with some urinary symptoms, thought it was a little suspicious then for the quick turnaround with the metastatic stage 4 prostate cancer diagnosis. Especially, I think what surprised me the most was in a guy of his age and someone that has been in, government life for the past 50 years. He's been getting good medical care, probably the best medical care in the country from his time as a senator to vice president, now president. It's very surprising that he has this aggressive form of disease to me and that it wasn't detected sooner. I have seen this before in there are kind of two patient subsets that I may see present with like de novo metastatic prostate cancer in my experience. Some of those are young guys that get their very first PSA checked and it ends up being very high and they're unfortunately like metastatic at diagnosis. They may have a bad family history, that sort of thing, other risk factors. And then on the flip side of that, in residency, this wasn't uncommon. You get some old guy that really hasn't had much access to healthcare, hasn't really taken part in healthcare his whole life, may come into the ER with some sort of nonspecific complaint, gets a CT scan, they find bone lesions or lymphadenopathy consistent with prostate cancer, and then he gets diagnosed at that time. So, again, I think the surprising thing was someone that's had access to healthcare that President Biden had to be metastatic at diagnosis was a little perplexing to me that it wasn't potentially picked up on sooner.
So, that's what seems so unusual here. Now, I saw one doctor, I think it was on CBS, I saw a clip where a doctor said, when you get to a certain point, if you don't have any prostate issues, they stop checking your PSA levels. But that just seems highly unusual to me, that especially, as you note, a man who's getting the best medical care on the planet, they would stop checking that stuff. Is that something that does happen where if you get to a certain age, they just don't check your PSA levels anymore?
Yeah, it definitely happens. And, our guidelines from the American Urological Association, that's what I practice. There are other guidelines out there, but we typically recommend prostate cancer screening. It should at least start at the age of 50 and go to age 69. For men that are higher risk, you can start that screening process at 40. And for other guys, you can have a conversation even starting at between 45 and 50 and going up until age 69. And then over 70, it's really shared decision-making process. There are some guys that are a healthy 70, and if you have a greater greater than 10-year life expectancy, and you're over 70, you can still justify doing PSA screening. And the flip side of that is, you also have some young guys that may not be that healthy. You may have a 65-year-old that, isn't in great health, and you're like, I probably shouldn't check this guy's PSA because, prostate cancer is a very slow-growing, non-aggressive cancer. I heard it put well by a radiation oncologist. I knew he calls it a lazy cancer. It really takes time to grow. And, in older guys, you're probably going to die of something else and not die from prostate cancer, even if you have some. There have also been cadaveric studies done that have shown that, majority of men over the age of 80 probably have some sort of low-grade prostate cancer. Now, that brings us to Biden, who, he's, I believe he's going to be 82 or 83 this year. He is over 70. So, if you're strictly adhering to the guidelines, you would say, maybe we shouldn't check this guy's PSA anymore, especially we do know he has other health issues. Life expectancy, that's far from my judgment to make, but, he may get another 10 years or so. So, I think there could have been some guidelines-based medicine with him, being like he's over 70, his other medical problems, we shouldn't check this. But I think the flip side of that is, he is the president of the United States, and, he's still the leader of the free world. You need to be looking out for his health. I think he was still getting his routine screening colonoscopies. The PSA is a very accessible, cheap, easy test, and I think that was surprising to me. I looked up his physical results from last year, and I don't think a PSA was included, which again, if he wasn't president and he's my patient, I'm probably not checking it. But I think with him being president, that did kind of catch me by surprise that it either wasn't checked or wasn't reported.
Yeah, you're right. Dr. Patrick Leidig is here, my old college roommate from Villanova, a urologist now in Georgia. So what about this Gleason score of a 9, grade group 5? What does that mean from the standpoint of how serious this is?
Yeah, so that's, close to the highest Gleason score. Highest Gleason score is 10. So not to get too technical, but Gleason score is it's a diagnosis given by the pathologist. Essentially, when they look at the prostate cancer specimen under the microscope, they're looking for certain features within the cells. And basically, a higher Gleason score means the cells they're seeing look very dissimilar to normal prostate cells. They're very poorly differentiated is the word we would use. And they actually look for the 2 most common variants. So each single Gleason score is 1 to 5, and then they add them together to get a total score. So they're looking for the 2 most common type of pathologic variants. And I think Biden, being a 9, I don't think they reported it was 4 plus 5 or 5 plus 4, but both of those combined will give you 9. So he is very aggressive, high risk. We know it's stage 4 disease. The grading system, we have different grade groups. We have 1, 2, 3, 4, 5, and it kind of goes from lowest Gleason score to highest Gleason score, and it puts you in those different grade groups and different risk categories. And that's how we kind of stratify these patients and kind of tailor treatment options depending on how high risk you are.
So then is this something, as you read into it, even though it's aggressive, and I hate to say it like this, but is this the thing, this is not the thing that's going to necessarily end the former president's life? It could be this cancer spreading. It could be something completely different, given the fact that he is going to be 82 years old.
Yeah, it could, but the interesting thing about prostate cancer, especially metastatic prostate cancer, with all the advances that have been made with treatment, it can really be treated more like a chronic disease now rather than like an acute illness. A lot of other cancers you hear stage 4, you think that's a death sentence. This could potentially be the thing to eventually kill him, but it's by no means a death sentence. I've seen a lot of patients live for years with metastatic prostate cancer, and it can be very well managed. It can't be cured, but it can be well managed with a lot of the treatments we have now, especially if it's in there are kind of 2 big broad categories in metastatic prostate cancer. There's hormone-sensitive prostate cancer and then hormone or castrate-resistant prostate cancer. And when it's hormone sensitive, it's extremely treatable. He'll probably, if he goes on the appropriate therapy, his Mets may all shrink. His PSA will go to a very low number. And then at some point, the prostate cancer develops resistance to those treatments, and you'll see new disease pop up. PSA starts to go up. But even at that point, we still have a lot of other additional treatments to offer patients that can both, keep the disease in check and prolong life.
Okay. So then what does this look like from the standpoint of how long it takes to develop to the point of stage 4? If they weren't testing his PSA levels, is it most likely this had been developed for over years, or can you develop stage 4 prostate cancer in just a few months?
I would say it's been years. I think the quickest I've seen someone kind of go from no prostate cancer having advanced stage 4 metastatic is, maybe been a few years, but I would say with very good certainty it's been years. It would be highly unusual that this just developed from the time he left office until now.
Okay.
It's probably been brewing for some time, and I tell everyone that I diagnose with low-risk prostate cancer, I'm like, it'll be 10, 15 years before this really impacts your life. So I can say with pretty good certainty that's probably been years. I haven't really seen it de novo pop up like this, very aggressive in a matter of months.
Okay.
Now there are exceptions. Prostate cancer is usually like an adenocarcinoma because it's a glandular organ. But there are other subtypes of prostate cancer that can be more aggressive and may not necessarily be picked up on through a PSA test. You have like neuroendocrine variants, small cell, squamous. You have like intraductal. They're all very rare, and I would be surprised if that's like what he had. But that's just something I'm throwing out there because that could be more aggressive, and it may not be picked up on through a PSA test because those cancers don't make as much or don't make any PSA, so it can kind of be a little hard to pick up.
That's great. Well, Dr. Patrick Leidig, of course, my old college roommate from Villanova. The second best Villanovan we've talked about over the last week or so with, of course, Pope Leo getting the nod here in the last couple of weeks. So great stuff, my friend. Great to have you on the show. I never thought we'd be talking on the air about a former president's prostate, but here we are.
I know it's a small world, and just I feel like these are times we have to set politics aside. We're praying for the Bidens and his family, and I hope he gets the treatment he needs and responds to it. And you just want to see him maintain his dignity throughout these. These could be the final years of his life, and regardless of how you feel about him politically, he's served this country honorably for many years, and we wish him the best. And he's in good hands up there, and we'll see how it all plays out.
Well, if he needs a second opinion, I know who he should call. All right.
Well, I appreciate that.
Good deal, my man.
That, Pete. And thanks again for having me on. All the best to you, Katie, and the kids, and God bless.
All right. We'll talk to you soon, my friend. Dr. Patrick Leidig, my old college roommate from Villanova, on the show on KCMO Talk Radio, a urologist now down in Georgia, giving the insight on President Biden and, of course, what he's dealing with right now.